and it eliminates the pandemic threat. We've all been talking about the need for urgency. Are we organized in the right way to make permanent progress and meet this goal? This problem, the scale of it, requires unprecedented collaboration. It requires a new model for global collaboration and dedicated leadership and an ecosystem that's willing to engage and support it.
It seems to me what we're talking about, we've all been talking about, is a kind of two-track system where we do what we've been doing because we have no choice. We're not going to ditch that system right now, but we develop something more powerful and permanent, and that requires a different kind of entity. And I'm wondering who is going to run that entity, because I don't really think the government is probably the answer.
You know, we've really been asking ourselves and our community sort of the really hard question is, are we organized in the right way to harness the new scientific insights and this passion?
I think if there was a single focus entity in influenza, then that target and that timeline would be accelerated to bring the best science, bring together those interdisciplinary thoughts. I mean, we're in this room, we're probably vaccinologists, we're probably immunologists, we're probably working on some vaccine, made some vaccine at some point in our life, but we're not the chemical engineers or the other engineers or the anthropologists or others who bring critical insight and how you disrupt and deconstruct an age-old problem. And we've had these vaccines for 70 years. So this is an age-old construct that requires those creative chefs that come out of the kitchen and deconstruct the carrot cake and make it look like something different, but the best carrot cake you've ever eaten in your entire life. We need that for an influenza vaccine.
In case we haven't figured this out already, this is really very complicated, not only from a scientific and public health standpoint, but from a perception standpoint. So it is a perception which is a misperception that it is not a serious disease. But as Casey said, hundreds of thousands of people die of it each year, and when you get a pandemic, millions and millions of people. So we really do have a problem of how the world perceives influenza, and it's going to be very difficult to change that unless you do it from within and say, I don't care what your perception is, we're going to address the problem in a disruptive way and in an iterative way, because you do need both.
We need this moment of energy, this burst that complements everything that we've been doing for these years and collecting lots of information. This advocacy group that is single focused, that goes to Congress, goes around the world, says people are dying. The urgency, the time is now, and this group is focused on it. It is the advocacy group, that is the lobby group, it is whatever the group does, but it's got to get money from philanthropy, it's got to get money from government, it's got to not be distracted by these cycles and bureaucracy to get the job done.
One of the other complicating issues with flu is that as the human species evolved, you developed an adaptive immune system, which means that if you get exposed to something and then later on you get exposed to the same or similar thing, your body will remember it and make a good immune response. That really helps you. It saves civilization. It's very good in the immune system. With influenza, there's a thing called imprinting. People refer to it somewhat inappropriately as original antigenic sin. And if you get exposed to an H1N1 when you're an infant, every time you see any influenza, be it H3N2 or H2N2, your body is going to make a response against that, but it's going to be very distracted and it's going to go back and make H1N1. When you do get a universal flu vaccine, you're going to want to give it to 6-month-old kids.
You're going to want to give it to 6-month-old kids.
Because a universal flu vaccine, even for me at my age, is not going to be universal. It's going to call up other things that I've been exposed to.
We need, number one, this time to be different, and we also need to really organize ourselves in a way where there will be accountability for sustained action and not just response.
In the long run, over time, amortized, if the 2009 pandemic had been much more deadly, would that have ended up being a better thing for humanity?
What is it? What is it about humanity that wants to go to all the details and stuff and listen? You know, these guys like Fauci get up there and start talking. You know, he doesn't know anything really about anything, and I'd say that to his face. Nothing. The man thinks you can take a blood sample and stick it in an electron microscope, and if it's got a virus in there, you'll know it. He doesn't understand electron microscopy, and he doesn't understand medicine, and he should not be in a position like he's in. Most of those guys up there on the top are just total administrative people, and they don't know anything about what's going on the bottom. You know, those guys have got an agenda, which is not what we would like them to have, being that we pay for them to take care of our health in some way. They've got a personal kind of agenda. They make up their own rules as they go. They change them when they want to, and they smugly, like Tony Fauci, does not mind going on television in front of the people that pay his salary and lie directly into the camera. You can't expect the sheep to really respect the best and the brightest. They don't know the difference, really. I mean, I like humans. Don't get me wrong, but basically, the vast majority of them do not possess the ability to judge who is and who isn't a really good scientist. I mean, that's a problem. That's a main problem, actually, with science, I'd say, in this century, because science is being judged by people. Funding is being done by people who don't understand it. Okay, who do we trust? Fauci? Fauci doesn't know enough to, you know. If Fauci wants to get on television with somebody who knows a little bit about this stuff and debate him, he could easily do it, because he's been asked. I mean, I've had a lot of people, president of the University of South Carolina, ask Fauci if he'd come down there and debate me on the stage in front of the student body, because I wanted somebody who was from the other side to come down there and balance my, because I felt like, well, these guys can listen to me, but I need to have somebody else down here that's going to tell me the other side. But Fauci didn't want to do it.
Given, as you heard from the introduction, that I have been around for a while and have had the opportunity and the privilege and the pleasure of serving in 5 administrations, I thought I would bring that perspective to the topic today, is the issue of pandemic preparedness. And if there's one message that I want to leave with you today based on my experience, and you'll see that in a moment, is that there is no question that there will be a challenge to the coming administration in the arena of infectious diseases, both chronic infectious diseases in the sense of already ongoing disease, and we have certainly a large burden of that, but also there will be a surprise outbreak. There will be a surprise outbreak. There will be a surprise outbreak. And I hope by the end of my relatively short presentation, you will understand why history, the history of the last 32 years that I've been the director of NIAID, will tell the next administration that there's no doubt in anyone's mind that they will be faced with the challenges that their predecessors were. Often, when you get into the real world, the effectiveness of vaccines falls short of the original efficacy. That is not at all the case with the vaccines for COVID-19. So now we have 2 vaccines that are really quite effective. The mRNA vaccine, highly effective, extraordinarily efficacious, 94 to 95% for mild to moderate disease, and virtually 100% efficacious, because the real world effectiveness is even more impressive than the results of the clinical trial.
of a shot. We've got to make sure we clarify that with people. It has nothing to do whether or not it's effective. We know it's highly effective. Highly effective.
Come on, man.
She's had the flu for 14 days. Should she get a flu shot?
Well, no. If she got the flu for 14 days, she's as protected as anybody can be, because the best vaccination is to get infected yourself.
And should she not get it?
If she really has the flu, she definitely doesn't need a flu vaccine. If she really has the flu,
she should not get it again.
No, she doesn't need it, because it's the most potent vaccination is getting infected yourself.
I don't know whether the pandemic started in a lab in Wuhan or evolved naturally, but we should want to know. 3 million people have died from this pandemic, and that should cause us to explore all possibilities. Instead, government authorities, self-interested in continuing gain-of-function research, say there's nothing to see here. Gain-of-function research, as you know, is juicing up naturally occurring animal viruses to infect humans. To arrive at the truth, the U.S. government should admit that the Wuhan Virology Institute was experimenting to enhance the coronavirus's ability to infect humans. Juicing up superviruses is not new. Scientists in the U.S. have long known how to mutate animal viruses to infect humans. For years, Dr. Ralph Barrick, a virologist in the U.S., has been collaborating with Dr. Shi Zhengli of the Wuhan Virology Institute, sharing his discoveries about how to create superviruses. This gain-of-function research has been funded by the NIH. The collaboration between the U.S. and the Wuhan Virology Institute continues. Doctors Barrick and Shi worked together to insert bat virus spike protein into the backbone of the deadly SARS virus, and then used this man-made supervirus to infect human airway cells. Think about that for a moment. The SARS virus had a 15% mortality. We're fighting a pandemic that has about a 1% mortality. Can you imagine if a SARS virus that's been juiced up and had viral proteins added to it, to the spike protein, if that were released accidentally? Dr. Fauci, do you still support funding of the NIH funding of the lab in Wuhan?
Senator Paul, with all due respect, you are entirely and completely incorrect that the NIH has not ever and does not now fund gain-of-function research in the Wuhan Institute.
Do they fund Dr. Barrick?
We do not fund.
Do you fund Dr. Barrick's gain-of-function research?
Dr. Barrick does not do gain-of-function research, and if it is, it's according to the guidelines, and it is being conducted in North Carolina.
You don't think inserting a bat virus spike protein that he got from the Wuhan Institute into the SARS virus is gain of function?
That is